If a woman were to go to a man and kind of like touch his flaccid penis and say, I'm ready, let's have sex, that guy would say that that's absolutely absurd. Like there's no way that he's gonna be able to have sex and it feel enjoyable with a flaccid penis. And yet that's what we expect of women all the time, is to have sex with a flaccid clitoris, okay?
A flaccid clitoris.
Yes, I know. And it just takes time to engorge all of this tissue. So if a woman and her partner want it to like feel good during penetration, you gotta put in the work to engorge all of this tissue.
I'm Susan Yara, and welcome to My Life Online. We're gonna have a lot of fun and learn a lot together. All right, we're back with part 2 on how to have the best sex of your life with Dr. Amy Pearlman. She is a board-certified urologist who specializes in male hormonal and sexual health. She also works with women now because they tend to be the partners of a lot of her patients. And this episode is focused all on women, on our libido, the medication that we can take, which I had no idea we could take when it comes to being aroused. There's actually medication for that. She even talks about vibrators. She talks us through our anatomy, which surprisingly, even for me as a woman in my 40s, I didn't know some of this stuff. So it is so interesting. If you have not watched part 1, definitely go back and watch that. I'm telling you right now, even if you're not a man, you'll still learn a lot. It's a fun conversation. And then watch this one because it's all about us ladies. Women can experience, and I know all the women watching are like, yeah, of course we can. We can experience low libido, and it can be either mentally or physically something's happening within our bodies. So we're going to talk about all of that. Starting with, I already know what you're going to do. We're going to talk about female anatomy first, right?
Yes, because in order to understand dysfunction, we have to first understand normal structure and function. Okay. So we spoke about the male pelvis, and now I want to describe the female pelvis. So enter the female pelvis.
I love it. So the female pelvis is so much prettier in my opinion. It just makes more sense.
It's a little bit more compact here. So if we look at all of these tissues here, it's all these pelvic floor muscles, okay? The pelvic floor muscles surround a lot of organs in the pelvis and essentially is a hammock. We pee through the hammock, we poop through the hammock, and we have sex through the hammock. So if a woman is coming in, and even if she's coming in for, let's say, pain with penetration, I always broaden that conversation to ask about urinary health and bowel health as well, because the common denominator are the muscles. So just take a look at this. The pelvis is actually a very complex area of the body, all right? Now, going a little bit deeper into anatomy here, okay? Take a look at this one next. You have the labia majora, the labia minora. We have the clitoris up here, right? Vaginal canal here. And then if you open up the labia, you're going to get the urethral meatus, or the tube that we urinate out of. So that's relevant. You might wonder, why do women get more urinary tract infections than men, right? Because UTIs are way more common in women than they are in men. And one reason is that the urethra is so much shorter in women than in men. And just think about like the proximity of all these other organs here. So some women will get urinary tract infections after intercourse.
Right. Well, which is why they always tell us to pee. It's like one of the first things they always tell us. That was like the first thing I remember learning at like 15 in sex ed.
Right. So if you think about like all the action that's going on here during intercourse, and the urethra is right in there, right? And so if you get like some irritation, there's some bacteria there, the bacteria can just like go in the urethra. And all it has to do is like climb a few steps and that person could get a urinary tract infection, right? You also have the rectum that's close by. So it's just, there's a lot of stuff going on in this area, and the urethra is significantly shorter in women than in men. For the purposes of today's discussion, we're really going to focus on sexual health, which is where this model right here is extremely powerful in terms of understanding really how the tools that we're going to discuss can actually help, vulva and vagina owners. So again, we see that this is the external genitalia, but the clitoris is literally just the tip of the iceberg as we see it here, right? Little thing right there.
Right.
We always focus so much on that little round object right there. But what is going on beneath the iceberg? Well, let's turn this around. Look at all that tissue in the back.
Right.
Look at all of that tissue that we need to engorge for a woman to be aroused and to feel a penis or a finger when it's in that area.
Right.
And when we think about, you had asked me previously, what are like the similarities and differences between men and women? Well, look at all this erectile tissue that a woman has.
Right.
This is the same amount of erectile tissue as a man has in his penis.
Interesting.
So,
which we never think that.
Yeah, we never
think they
think
have
that.
them like just so much more happy.
Yeah. So there's a lot that's going on behind here. And one reason why that's important is we think about how a lot of women may not be able to climax with penetration. All right. It's not that most women are unable to climax with penetration. It's that most women have never been taught how to climax with penetration.
Huh. That's a good point.
Yeah. And so Susan Braden, she's an intimacy specialist. She has incredible content online, talks about this a lot. And it's like, if a woman were to go to a man, we'll talk about like in the context of this discussion, a lot of heterosexual relationships, but obviously this is broad and can really, expand to really any type of relationship. If a woman were to go to a man and kind of like touch his flaccid penis and say, I'm ready, let's have sex, that guy would say that that's absolutely absurd. Like there's no way that he's going to be able to have sex and it feel enjoyable with a flaccid penis. Mm-hmm. And yet that's what we expect of women all the time, is to have sex with a flaccid clitoris. Mm-hmm. Okay.
A flaccid clitoris.
Yes, I know. And it just takes time to engorge all of this tissue. So if a woman and her partner want it to like feel good during penetration, you got to put in the work to engorge all of this tissue. So how might you do that? Well, another concept that I know you talk about a lot is like that foreplay, right? It's getting people primed. When does foreplay start?
During the day when they start talking to you and sending you messages.
As soon as you wake up in the morning.
Doing nice things for you.
Yeah. Like how do you start your morning, right? How do you like say goodbye as you're going to work, right? And if it's like a quick peck on the cheek and like you're out of the door, you think that's going to turn on the clitoris later at night?
Nope.
Right? It's like the sexy text message during lunchtime. It's like, hey babe, was just thinking about you, right? That's already priming this tissue for a lot of couples. And so foreplay really starts in the beginning of the day. We have to give it time because it can take like 20 minutes to engorge all of this tissue. So when we think about tools, right, that can maybe allow it to take less time than 20 minutes, that's where vibrational products can be very helpful because sometimes we don't have 20 minutes. One of your recent guests was talking about how she went on a beautiful vacation with her partner and they had several quickies that lasted about 7 minutes, right? There is a time and a place for a quickie, right? And so if you have to like then engorge and do foreplay for 20 minutes and then have sex, sometimes that takes a little bit long. So can I show some tools here?
Absolutely.
Right. So like the original gangster, the OG.
The massager. When your aunt is like, it's my neck massager.
I love this product. And I don't know that I can fully explain why I love this product. It is the magic wand. And there are a lot of different iterations of a product like this. But if we go back to the anatomy and what's hidden here, right? You can use like a bullet vibrator. This one is kind of cute because it looks like a lipstick.
Oh, yeah.
One of the fears that I hear from a lot of people is, I have no privacy in my house and my kids get into everything. And what if they find my vibrator? Like that could be the biggest reason why they don't get something. So some people like getting products that don't look like vibrators. They just look like a lipstick.
My daughter put that on her lips. Please don't.
So there are some products that don't look like vibrators, right? So this is more of like a bullet vibrator. And so you could put it like right on this area, but you're kind of still missing out on all this other area. So this surely has a time and a place, especially if you're, let's say, bringing out a toy for the first time with your partner. And if you bring out this magic wand the first time that you're with a man, right? And you haven't spoken about this product and he's never seen it before. And so I think the time to have some of these conversations about pulling some of these items out is before you're in a vulnerable state and you're naked. And so this is where I've learned some techniques from my sex therapy colleagues, is coming from a place of adequacy rather than a deficiency, right? And it could be, I love Dr. Lisa Paz, who's a sex therapist in Miami, talks about saying something like, babe, you're so sexy. And I really enjoy the time we have together. And I was talking with my doctor the other day and she recommended that we try this product. What do you think? Or babe, I had a dream that I was using this product on you and you looked so sexy during that time. Like, what do you think? So it's coming from a place of abundancy, right? I love you. Our sex life is great. and I wonder if we can experience something new. Susan Bratton talks about the monotony of heterosexual monogamy. And it's just making things a little bit exciting. You know, a lot of people think that people will hit their peak in terms of libido and sexual health when they're like in their 20s. And yeah, the research suggests that when it comes to libido, men will kind of hit their peak in their 20s and women a little bit later, 20s and 30s. I truly believe that people can have their most amazing sex lives as they get older. I'm 38 years old. I feel like I'm hitting my prime. I feel so comfortable in my body. I know what things work for me and I know how to ask for it. And I believe that my patients that see me in their 70s and 80s, I think they're having better sex than a lot of the people that I see in their 20s and 30s.
I mean, we hear some of the stories about these retirement homes.
Absolutely. You know, and some people say, oh gosh, I don't know if I'm going to be having sex in my 70s. I'm like, I pray to God having sex in my 70s. You know, I've spoken to my parents before, like, hey, mom, dad, like, you guys are my prime demographic. Like, if you have any questions, I am an expert.
Oh my
like,
gosh.
Pound the curve, baby. And I'm like, no, seriously, you guys are in my prime demographic. I don't care whether or not you're having sex, but if you are, I can help you. You know?
Right.
And I know that sounds strange, but wow, what a beautiful thing to have with your partner when you're, you know, in your 60s, 70s, 80s, and 90s. So anyways, going back to like these technologies, you have to be pretty precise with this and you're only getting one part of this whole tissue when you do it versus using something like a magic wand. And to be clear, this does not go inside the vagina. This is external, but you could put this like on the pubic bone, like on the area right here. And that's where the nerves are. So you could literally vibrate this entire area, even without putting this directly on the genital tissue.
Or just
like while you're being penetrated. Absolutely.
Oh, okay.
Yeah. You could put it on the clitoris. You could literally put it like on the whole vulvar area. Because remember, what's behind even the vulva? All of this erectile tissue. And so you don't have to be as precise with something that's a little bit larger. And it can help get someone engorged quicker than, let's say, like a finger or a tongue, for example.
Right.
So look, I would never want to tell someone that a vibrator is going to be a replacement for a partner, but it is a tool. And the reality is a lot of men that I see, and just a lot of men in general, they don't always want to put in the work. It takes a lot of work to get us aroused, right? And it's not that he's lazy. Sometimes he just may not have the technique. He might not have the playbook. We might not be telling him what feels good or what doesn't. But think about like when we climax, like, okay, when I am like self-stimulating, do I use my hand? No. Why? It's a lot of work. I don't even want to put in the work.
Right.
Why would I expect my partner to want to put in the work, right? I just want to enjoy the experience. Like I want to just like lay back, feel the sensations and not have to worry about like what my hand is doing. And I don't think that makes me lazy. It's just that's how I experience pleasure.
Right.
And so I think that's how it can be incorporated right into a partnership.
For a woman.
Yep.
Do you feel like sometimes this is truly all that's needed to like enter the space with a vibrator, whether it's a bullet, a little lipstick, or the magic wand?
Yes and no.
Okay.
I do recommend vibrational products for a lot of people, but if someone doesn't want to use their vibrator, they're not going to use their vibrator. And sometimes it's hard to like push against that barrier, even though they know once you're using the vibrator, it feels good. It's the same thing. I have a lot of women that come in and they say, once I'm having sex with my husband, it's not that bad. It just takes a lot of effort to have sex with their husband. So my goal in my clinic is to give them the itch they need to scratch. So instead of it being so laborious, right, to just like get into the mood, I want them to wake up in the middle of the night and be like, damn, like I need to take care of this, right? I actually had a patient recently. She is like in her 60s, went through menopause. I've been seeing her husband for about a year. And I have him on testosterone and Cialis. And he was seeing my sister who you've had on your show previously. He's lost a good amount of weight. This guy feels amazing. He likes what he sees in the mirror. He's getting great erections. You know, he's building muscle. He's like crushing it. And so his wife comes in and she says, I love my husband. We have a great relationship. I just don't want to have sex with him. And now it's causing a problem in our relationship.
As it would, yeah.
Because before you treated him, Dr. Pearlman, neither of us cared. and it was fine.
Right.
But now I don't want it and he does. And he's coming after me with his rigid penis and it's grossing me out. It's causing a problem. Now we're fighting about it.
Mm-hmm.
The largest sex organ is the brain, right? So for her, we're treating this from a lot of different approaches, right? We're making sure that her systemic hormones are on point. That's why she's seeing my sister, right? Testosterone is actually a hormone that we use off-label in women that can help with libido. So she's also on systemic testosterone therapy, but that can take months to take effect when it comes to libido. Then she was seeing me for genital health, because if someone has genitourinary syndrome of menopause, reduced lubrication, reduced arousal, you could put any type of vibrator on that tissue. It could be painful, right? So you got to address the genital health. And then I was also addressing the brain component here. And we now have medications that are approved in premenopausal women who have low libido. Now, I will use them off-label. I use them off-label in postmenopausal women, and I'll actually use the same medications in men who come in with reduced arousal and libido. So I started her on a medication called Addyi. Okay. Some people describe this as the little pink pill.
Okay.
Or the Viagra for women.
Okay.
It's spelled ADDYI. It is approved for premenopausal women with hyposexual desire disorder. Okay. It is a pill. It is the first FDA approved pill we have for this issue. Now, the big thing, and I know you've discussed this previously on your podcast, is bother. Is low libido a problem if someone's not bothered? No. So these are women coming in and they're bothered by it, right? So this is a pill that a woman would take every night before bed. So she doesn't have to time it.
Okay.
She doesn't have to time it. She just takes it
have to
every
be
night
like
before
right
bed.
before they're about to get like hot and heavy. She's just taking it before bed. And
Correct.
That way she's ready
and
to go
some people
anytime.
like more of the on-demand, and some people are like, I don't want to think about it. I just want to take it, right? So she started this medication, and it can take a month to take effect. So she sees me recently, and she says, Amy, the other night I woke up in the middle of the night, and I wanted to have sex with my husband. And I was like, ooh, so then what happened?
Progress.
Yeah. She was like, and I thought about it. And I thought about it some more. And I decided I'm not going to wake him up. And I was like, what?
Which he probably would have loved.
And then she told him later. And he was like, what the, And so I ended up meeting with both of them that day because he was there seeing my sister. So we're sitting in the office and all of us are talking. And I was like, I really think you guys should see like a sex therapist. But they were like, you're our sex therapist. And I was like, I'm not a sex therapist. But obviously sex therapy is very complex. But a lot of my patients do look at me as like having some of these, sensitive discussions and helping facilitate the conversation. My advice to this couple at the end of the session, I looked at her and I said, the next time you wake up in the middle of the night and you have that itch you need to scratch, I need you to wake him up.
Yeah.
Okay. And then my advice to him was stop coming at your wife with a rigid penis. And he's like, but I don't do it that often. I'm like, perfect. Then it won't be that difficult to just stop completely.
Yeah.
Yeah. So,
she's scared.
So we have to meet them both somewhere in the middle. There is another medication that is used on demand, which is also approved in premenopausal women. And it's an auto-injector pen. It's called Vyleesi. So this is approved in women. I use it off-label in some men. And I've had some men, even though I wouldn't primarily use this to treat something like erectile dysfunction, I've had some guys say, wow, my erections are like I was when I was 19 years old. And so this, just like the medications like Ozempic and Wegovy, comes like in an auto injector. And so the person about 45 minutes before they want to engage in intimacy would just use this pen, inject themselves, and it can improve arousal, libido, and the sexual experience.
Amazing.
So we have 2 medications now that just make it a little bit easier to feel that arousal. Right. And so when you ask, like, is it just as simple as giving someone a vibrator? Sometimes yes, and sometimes no.
For your female patients, do you ever talk about, we know for women, it's a lot is happening here in the brain and mentally. And especially if they've been in a long-term relationship for a while, it doesn't turn them on because there's just something that the guy is doing, right? Like men are expecting us to just be ready to go. And then for us, we're like, it's like you said, it starts in the day. Right? So are you also counseling them on this?
Yeah, but everyone loves variability and everyone gets bored by the same mundane stuff all the time, right? We think it's only like men who need variety. No, women need variety too. So I think like the second thing I would say is be creative. That's where I think a lot of Susan Bratton's content is awesome. She gives people like the actual tools. So she'll have like a document where you could just like sit down with your partner and you could talk about fantasies, right? And you could even do this when you've been in a relationship for 30 years, right? You could talk about your like sexual fantasy bucket list. And so you might throw out a scenario that is have sex in a public restroom. And so you bring up that fantasy and then your partner might say like, yes, I would do it. No, I wouldn't do it, or I'd consider it.
But do women, before book talk, before like these romantic stories that my friends got me into reading, I feel like me and a lot of my girlfriends didn't have true fantasies. Like people say this all the time, but like 10 years ago, if you would have asked me, what's your fantasy? I would have been like, I want him to clean the house, like that kind of thing, like take care of the babies when they're sick. Like it really took a while for me to like, I still do this. I'm like, what would be my fantasy? Like what really gets me going? And I really have to think hard about this. Do you find this with patients?
Yeah, but I think that's part of it is you have to be intentional.
Yeah.
Right? Because if you were to ask me, what is my fantasy? Like there's not like one single thing that comes to mind, but there are things that I think are hot.
Right.
And so I think we put a lot of pressure on having this phenomenal fantasy, but like, I don't know, just like someone touching my arm is like a fantasy.
There was a guy the other day, my son dropped like his backpack or something and he just kept going. And this man walking by goes, go help your mom. And
like, that's hot.
And I went, excuse me. I was not at all looking at this man until he said that. He's like, go help your mom. And the way he said that to my son, I was like, hello.
And that's fine, right?
Yeah.
You can explore all those things. And fantasy doesn't mean penis and vagina.
Right.
It could just be like the way that you text message, with your partner or something like that.
That's true. One of the last topics I want to get into when it comes to women is we talked about how we enhance men. Do we enhance women? And this was a topic when I first became single. Suddenly I was like, wait, I haven't, shown my body off to somebody in a long time, to another person in a long time. I start talking about this with my girlfriends. Like, how are people, like, how do they even groom down there nowadays? Like, what are all these things? And the topic came up that women are now enhancing their labia.
Yeah. And this is not something that I currently offer in my practice. And this is where it becomes a very interesting conversation. Again, it's kind of like skirting this fine line between what the evidence shows, like the safety profiles and innovation. So it kind of, you always want to go to, whenever you're thinking about like doing a procedure, really on any part of the body, especially the genitals, going to someone who has a lot of expertise and if there's a problem can fix it, right? But some of the things, not everyone requires a procedure. So even for something like arousal or lubrication, the mainstay is still going to be the same mainstay for men, which is exercise, nutrition, stress, and sleep management. Okay, so that's kind of like the foundation. Next is going to be medication. So what is the role of vaginal estrogen? Well, vaginal estrogen, some people will describe as the female Viagra. So vaginal estrogen, and briefly mentioned on a previous episode, the genitourinary syndrome of menopause guidelines recently came out by the American Urological Association. So even, if you're not a provider and you're a patient, they're very clear and concise guidelines that I think a lot of people would benefit from reading online. It talks about the use of vaginal estrogen or vaginal DHEA to just help the health of the tissue.
Is this being like put inside the vagina, on the outer part of the vagina? Because I've seen ads for this. Like there's a prescription company that does skincare prescriptions, but then also now offers, like estradiol or whatever, however you call it.
Yeah. So it's a little bit of both. It depends on the formulation. So in the sexual medicine space, I do want people to know that there are a lot of options that are available that you could get at a typical retail pharmacy that won't break the bank. Okay. And in the space too, people need to know what the terminology like bioidentical hormones actually means.
Oh,
all right?
Yes, very much so.
So in the men's space, when we talk about testosterone and bioidentical hormones, every single formulation of testosterone that we prescribe to patients is bioidentical. Do not be fooled. That can be in many instances a marketing term. Okay. In the female space, we used to use medications that were not bioidentical, but largely these days, the medications we use are bioidentical hormones when it comes to systemic hormone therapy. Okay. And these medications you can get for very cost-effective prices. It's typically like an estradiol patch, right? That is a bioidentical source of hormones for women. So when we talk about the local tissue, even women who are on systemic hormone therapy with something like estrogen, testosterone, progesterone, oftentimes people will also need to treat the local tissue.
Like the outer area.
Exactly.
Okay.
So it's really important that when we're prescribing a medication, we actually teach people how to apply the medication. Right. And so what you would do with a topical estrogen product for the vagina is you would put like a little pea-sized amount on the finger, and then you would apply it on the whole like inside of the labia right here, right? The urethra is up here. That can be irritated, can increase risk for urinary tract infection. So you can get that area. And then like on the inside of the vagina, you're just rubbing it into that tissue. And if you rub it in, just like you would rub in suntan lotion, then it's going to reduce the mess.
Yeah.
So a lot of women are going to get away with just like standard, prescription estradiol topical. Okay.
And what is that helping exactly?
So it can help with arousal. It can help with lubrication. When women go through menopause, they lose the estrogen in this area. So what happens? Women experience urinary urgency, urinary frequency, urinary tract infections. They might leak urine on their way to the bathroom, or with exercise or sneezing, they might leak urine, okay? They can also have pain with intercourse. In many ways, people can develop what is really equivalent to a sunburn of their vulvar and vagina. You can imagine how that would be painful.
Absolutely.
Yeah.
Absolutely.
So oftentimes, pretty much nearly every woman is a candidate for vaginal hormone therapy.
Okay.
And so it's really just like you would put a lotion on the hands to, moisturize the skin. It's just doing that for this tissue. Moisturizers and lubricants are not treating an underlying estrogen deficiency.
Right.
So that's where, topical vaginal therapy can be very helpful.
Would it affect, does it actually systemically affect you? Is it almost equivalent as like me taking a pill?
No. So it's very different. So this is really treating the local tissue and is not considered systemic therapy. And when you look at like the blood levels, it's not really entering the body.
Okay.
Yes.
That's interesting to know too.
So even women who, let's say, have a history of breast cancer, right? Or women who may not be candidates for systemic hormone therapy, it is so rare that someone would not be a candidate for local vaginal hormone therapy. And for women who have a history of breast cancer, have been on certain treatments, that's where really having a shared decision and conversation with your healthcare provider is very important.
Okay.
Yeah.
That's really good to know. So can that also help the look of it?
So what also people don't realize is that the labia minora, these inner lips, they tend to shrink and oftentimes go away as women get older.
Wait, I saw a TikTok of this. No one talks about this. This woman was like, no one told me that during menopause, my labia my vagina would just like shrink back up into itself. And I was kind of like, what? What do you mean? Please explain this. Because I did not know this.
Yeah. So the tissue changes as women go through menopause.
Yeah.
Now the question becomes, I don't know that we know the answer of whether or not applying this local therapy will cause them to come back. But I think it's very important for people to know what are the changes that's going to happen with their anatomy. But yeah, the inner labia oftentimes will like decrease or go away as women go through the menopausal changes.
Interesting.
Yeah.
And then also, is there like when you're young, like you've got like a plump vagina, like your labia is like really plump. Does it change over time also, like lose that volume? And does this help? That's
a good question. And I don't know if like the topical therapy will like plump things back up again, but it certainly can help with like arousal and lubrication. The other thing to keep in mind is like with the clitoris up here, sometimes people can develop clitoral adhesions. So just like a man who, let's say, is uncircumcised can have foreskin that goes over his penis, it sometimes can become tight and prevent you from being able to bring the foreskin behind the glands. You have foreskin that's like covers the clitoris as well. Sometimes that can scar over the clitoris, and that can make it painful when someone is being stimulated during intimacy, or make it difficult for someone to reach climax. So when we do an exam on a woman, I use a technique, very simple technique that my colleague, Dr. Rachel Rubin, spoke about, is giving a patient a handheld mirror and just showing her exactly what I'm looking at and describing everything I'm looking at in terms of her anatomy. So she knows what to look at when she's at home, so she can actually understand some of these changes. But we're definitely looking at the clitoris to make sure I can expose the tip of the clitoris during that exam.
You know what's crazy about you saying that? I've seen so many gynecologists, and after having 2 babies, and like a monthly visit to the gynecologist during pregnancy, I have yet to have a doctor hand me a mirror and be like, let me talk to you about your area.
And I think what a lot of people want to hear, and this is both men and women, they want to know they're normal.
Absolutely.
They want to know they're normal. I had a woman the other day, she's, I would say like in her 50s, and I did her exam, and she was like, is everything normal? Like, everything is normal. And I just outlined all the anatomy. And I definitely say that in men because First of all, men don't typically get engaged with the healthcare system until much later than women, because men are not popping babies out of their pelvis, right? And so they'll typically see a pediatrician. And then, I don't know, once they're 16, 17, 18, like when's the next time a man actually sees a doctor?
And
it's when he actually has a problem, right? Yeah. And then we're like, why did it take so long to get in? And he's like, who was I supposed to see? You know, because he's not plugged in. And so oftentimes they'll come in their 30s and their 40s. And like the last time they saw a doctor, they were like a teenager. And I don't know that their pediatrician told them like anything was normal. They probably just did like a hernia check and then sent them on their way, right? And they're super embarrassed anyway. They're not listening to what the doctor's saying. So whenever I do an exam for a male patient, I'm walking through every part of that exam with them. I'm like, here's your testicle. This is how you examine the testicle. Do you feel on the back part of the testicle, it feels like a chewed piece of gum? That's your epididymis. This is what it does. Do you feel that al dente piece of spaghetti? That's your vas deferens. That's what brings that sperm from the testicles into the urethral channel. I show them what I'm feeling in terms of like the penile exam. And after the exam, I look at them and I say, everything looks and feels normal. Because men also want to hear that sentiment.
I imagine. Yeah, for sure. Back to female enhancement. Yeah. The article that we had read specifically was that women were getting HA filler in their labia. Yeah. The outer labia. Yeah. What would be the point of that? Just aesthetic?
Yeah, like as you mentioned, like to get some of that sort of like puff or sort of, you know, the fullness back, right? So one of my colleagues who's doing kind of like a labial puff with hyaluronic acid. There are other people that are using PRP or platelet-rich plasma. There are people that are using lasers. Admittedly, I haven't delved into that space when it comes to women's health, but you know, I'm sure I have a lot of my colleagues that say, oh my God, Dr. Pearlman is doing girth enhancement with hyaluronic acid. And they're probably talking like mad shit about it. I've done my research. I've learned the protocol. I know how to do it safely. I know my patients are some of the happiest patients I see. So yeah, that's where I'm like going into the innovative side. And I know I have research and clinical expertise to support it. So I'm not going to poo-poo any of my colleagues who are offering some of those more innovative therapies because admittedly, I don't have the expertise that they do. So all I would say to anyone considering any of these more cosmetic procedures on the genitals is go to someone that you trust and do your due diligence.
Right. Okay. All right. But it sounds like there's no like actual, besides aesthetic reasons, there's no reason for a woman to be putting filler down there for pleasure.
You know, I don't know if HA filler, like in the labia, I don't know how it might impact, you know, sensation. Some people ask, well, how does filler in the penis impact sensation? Yeah. Well, I've had a lot of people say it makes sex feel a lot better, right? Both for like the man and the woman. So, I mean, it could be the same thing for women. I just don't know.
So the way I want to wrap this is, you know, I feel like for a lot of women, our mentality around sex really changes after we have babies, partially because our bodies become utilities almost, right? Like our breasts become, you know, functional because we're using them to feed. And then our bodies, I mean, one, like it's scary down there. I've had a friend say that their doctor was like, at the 6-week mark, like, you're cleared to have sex. And they're like, am I though? And they're like, you can say to your husband that I didn't clear you. Like, it is up to you. What do you think women can be doing after that experience to get back into it?
I am a huge proponent of women seeing a pelvic physical therapist before childbirth.
Okay. Before pregnancy.
Even before, I mean, honestly, there's not a single person I can think of that wouldn't benefit from just seeing a pelvic physical therapist, period. Why? Because the pelvic floor is involved in this process of peeing, pooping, having sex. We do those things multiple times a day. Right. And so even, you know, pelvic physical therapists will teach grown people how to pee, how to poop. That's important.
Yeah.
Right. And so as women go through pregnancy, there's so many changes that are happening in their body. And the pelvic floor is not just this trampoline that we're like sitting on. It's really from the belly button to the thighs, from the front to the back. And our pelvic floor is impacted by how we're breathing and the movement of our diaphragm. I've treated a lot of men after prostate cancer surgery where we cut through the pelvic floor muscles. And it's like, it's much easier to teach someone about their pelvic floor before we operate on it. Think about all the havoc that occurs when you push a baby through your pelvic floor. And even with a cesarean section, right? Remember, the pelvic floor really starts up here. You're cutting down here. That will impact how the pelvic floor functions. And so what better time to educate someone on their pelvic floor than before something drastic happens to it.
Right.
And even for a single session. But the fact that we have women go through labor and we don't have them meet with a pelvic physical therapist to like understand how to push something so big through that area is crazy to me. Yes, we teach them. So I mean, I don't know what the process is. I've never been pregnant.
They don't teach you.
Like, they teach you kind of like breathing exercises. People need more information.
They don't teach you. You have to go to, you have to sign up for seminars that if you don't sign up for it right away, especially I was in Los Angeles.
Yeah.
They might fill up.
Right.
And then you might be limited. There are just like not that many options, and your doctor isn't really walking you through it. You have to hire a doula then.
Yeah. So look, it is never too early and it's never too late to see a pelvic physical therapist. I would recommend before doing anything in your pelvis, whether it's like, any type of surgery. This is both for men and women, whether it's like a hysterectomy for fibroids or pregnancy, see a pelvic physical therapist. What they can also teach you before is how to get out of bed after in a way that doesn't put pressure on your pelvic organs so that you might leak less urine when you get out of bed. Or you might be putting less pressure on the cesarean section so it's not as uncomfortable. They'll teach you about squatty potties, right? So you can more fully evacuate the rectum. And they'll teach you about pelvic wands. I love this product. This one in particular doesn't vibrate, but they also have one that vibrates. This would go in the vagina and all the muscles surround this vaginal canal. So a lot of people have pain with penetration. Well, if someone has a trigger point in there that's very painful, you could target that area with a wand and just push on that area, just like you would use a foam roller on your quad muscle after doing leg exercises.
Right.
You could push on that tissue, use some vibration. Vibration is good to reduce pain, right? And so oftentimes by using just a simple tool like a pelvic wand, you can take someone from being in pain to being neutral, and then from being neutral to feeling pleasure. This one can then go in the rectum too, because again, those muscles surround the rectum. So I have a lot of men that use a pelvic wand. They have pain in their rectum or their perineum, and so they can target some of those areas with the back part of this wand. I do recommend, even though you don't need to see a pelvic physical therapist to use a device like this, I do recommend seeing one just for some more guidance. People get nervous about sticking things in that area, especially when it's for medical reasons. So a pelvic physical therapist can be really good at helping you understand what exactly are you doing? What exactly is the goal here? But I love pelvic wands.
That's great to know.
Yeah. And also, oftentimes after someone goes through a pregnancy, they're leaking urine, they have bowel issues, they have pain, they want to go back to their activity, but they're leaking urine when they do a jumping jack. That will impact how someone goes about their day. And then they're wondering, oh my God, it's been 6 months and I haven't exercised. Well, who wants to piss their pants when they're exercising?
Right.
No one has to suffer with that. That's when I say we need tools in the toolbox. It's also building a team. You need your team, like your pelvic physical therapist, that you can go to so that you can shorten the amount of time from leaking urine to not leaking urine. And even in women who, let's say, still have issues, even after, let's say, seeing a physical therapist, there are pelvic surgeons who can also offer surgical options that these days are considered very minimally invasive that can get people dry.
Interesting.
Yeah.
Okay, that is really good information. This has all been so helpful. I could honestly sit here for like 2, 3, 4 more hours, maybe even have a drink afterwards and keep talking about this topic. So we'll probably just end up having you back on at some point. I know there are going to be so many questions and comments in the comment section. So thank you so much for joining us and for doing 2 episodes, because I think we're gonna find out a lot. People learned a lot from this for sure.
Awesome. It's been really nice to be here. And I think my message for really anyone watching is I'm not trying to create problems where they don't exist, but there are a lot of concerns that people have, whether or not there's a medical diagnosis associated with it. My role on this earth is to help people maximize the time they have on this earth and to be comfortable in their bodies, right? And so educate yourself, know your anatomy, build your toolbox. Those are my recommendations. Everything that we discussed today goes hand in hand with the sex therapy, right? So that's where people really get their optimized health, is when we combine everything. But I want people to know that, like, in addition to things like therapy and coaching, there are medical and surgical options that can also be helpful.
I love that. Thank you so much.
Thank you.
Thanks for joining us on this episode of My Life Online. If you enjoyed this podcast, make sure to follow, rate, and review, and also share it with a friend so we can continue making great episodes for you. You can also find me on social media. I'm at Susan Yara. And if you enjoy beauty, especially skincare, make sure to check out my YouTube channel, Mixed Makeup. I'll talk to you soon.